Welcome back to Beyond the Limits, the podcast where we dig into health fads, medical breakthroughs, and the science of performance to separate fact from, well, you know the drill. I am Matt Clark.
And I'm Mike Forsyth, and today we're diving headfirst into a part of our health that's often overlooked, but critical to our overall well-being. We're delighted to be joined by Dr Anni Seaborne, Head of Dentistry at Bupa, who's going to pull back the curtain on everything from the latest advancements in dental technology, including how AI is revolutionising diagnostics,
to the surprising truth about some of those viral TikTok dental crazes that promise a perfect smile but might actually leave you with more than just a sour taste in your mouth.
We'll also be sinking our teeth into the real science behind teeth whitening, busting some common myths about flossing. Is it really essential every day? And exploring the often missed link between the health of your gums and major systemic issues like dementia.
This is an episode packed with bite-sized advice, so stick around as we get to the root of... God, but Mike, these puns are truly terrible. The root of what truly works and what is just a fad. Lie back in your figurative reclining chair, pop on the oversized sunglasses and open wide.
Annie, thank you so much for joining us on Beyond the Limits. It's great to have you on.
Thank you so much for having me.
Matt and I know very little about dentistry, and I've got no real shame in admitting that, certainly myself. I wanted to kick us off, actually, just to ask about the general trends in dentistry at the moment, because I was thinking about this in terms of medicine and about AI for diagnostics, the evolution of medicine at the moment in the 21st century. Is that something you're seeing in dentistry as well?
Absolutely. Digital dentistry is really at the forefront of basically what everyone is doing. So as you said, diagnostics, so AI imaging, the same way that you've got AI imaging for radiographs, it's exactly the same for radiographs of the teeth. So using that, which helps a lot, because I think with dentistry, there's a lot of grey area, especially when you're looking at tooth decay. There's a lot of early tooth decay, and I don't know what the equivalent would be in medicine, but early lesions basically, and being like, is it going to develop, is it not? And if you have that AI capability to be like, actually with this person who has this lifestyle factors, this age group and this demographic, statistically it's going to more likely develop into a proper lesion, therefore you treat it, or versus that you don't treat it. We're big on digital scanning. We basically do 3D scanning of teeth, and it's able to create a 3D model, and that's what we use nowadays for mouth guards. We can send it across to labs, send it across the world. So yeah, I think dentistry is really pushing when it comes to technology.
So Annie, I'm going to move us on to an area that's very close to my heart at the moment, because I dobber in every episode, I feel, but we've got a wedding fast approaching, and I'm aware that there's some teeth whitening going on in the household at the moment, and this is clearly quite a big business. There's clearly a lot of people who would like to have whiter teeth, me included, but are we damaging our teeth in certain ways, and are there better ways to do it or not? I'm going to start off with charcoal toothpaste. What is that, and is that effective?
In small doses, yes, it is. So essentially all it is really highly abrasive substance that you're just scrubbing your teeth with. So you've got internal staining and external staining. External staining is like your teas, your coffees, your red wine, smoking. For charcoal toothpaste, it does help that. But internal staining or internal colouring is actually just the natural shade of your tooth, and it won't affect that whatsoever. What I will say though is you've got the layers of the teeth. You've got the bulk of it is dentine, which is actually a yellow shade, and you've got a white enamel on the top. When you're using an abrasive really heavily, consistently, you're just wearing it down over time. So actually over time, you'll just make your teeth more yellow.
That's really interesting about the external and the internal. Okay, what about peroxide-based substances? And also there's a particular brand, again, I won't name it specifically, but this is the one my wife's using upstairs. It claims to be this natural-based and peroxide-free whitening substance, and I think it's got calcium carbonate, pentasodium triphosphate. I don't know how it calls this natural, but a lot of nasty-sounding products. Strontium chloride hexahydrate. I guess what I'm getting to here, is there anything that's the gold standard and that is most effective or the safest?
Can I ask, did she get that at a dentist, or did she buy it over the counter?
I'm going to dob it in there. It's My Sweet Smile, it's called. Something that she found online.
Yeah. So, and they're going to be incredibly blunt, and I'm really sorry to burst your bubble here. Because of historically EU regulations and subsequently UK regulations, nothing that you can buy over the counter will work because it's quite frankly not strong enough. The only way to physically change the crystal structure of the tooth, which is essentially how it reflects the light and therefore makes it whiter, is with a peroxide-based substance. And the strength required needs to be a minimum of 6% for it to be effective. And that is what is essentially prescription only. It needs to be given by a dentist. So in the UK, you can't actually get anything that will work long term and actually change the structure. Anything you get over the counter will either be tricking the eye using kind of like a purple solution to make it appear whiter, or it will be oil pulling, so kind of making the tooth look more hydrated, or be abrasive, so getting rid of external staining. But actually anything that's advertised on Instagram or TikTok, I can tell you, is not likely to work unless you get it from a dentist.
This is groundbreaking. I can't wait to go upstairs.
In the UK, I will caveat, in the US, the regulations are different. So some of the stuff you can get in the pharmacy does actually work. It's not as good as the stuff you'd get in a dentist, but it's of a high enough concentration that you can get it. But it's also legal to import it into the UK.
Is this, you talked about changing the structure of your teeth. Is this something that is damaging to the teeth if someone was doing that on a regular basis?
No, it's absolutely fine as long as your teeth are healthy to start off with. So we always say you have to have a dental checkup before you can even consider it. As long as your teeth are healthy, it's absolutely fine. It's completely safe. What I will say, though, if it's too strong, it actually could damage the gums. You can get chemical burns from it, which is why it's important to get custom trays made.
I've actually done that. I did that about, God, it must be 10 years or so ago. Went and did it properly with a dentist, got a mould and a tray.
Did I know you then?
No, this was before, I think. I don't know why I did it, really. I must have had much more money than I do now. But I found that it did work, actually. It was my teeth were suddenly very bright and white, but I got really sensitive teeth because of it. I probably left them longer than they recommend. And then I realised it was pointless because I drink a lot of black coffee and some red wine. And then I think actually the dog ate the trays after that. So that was the end of that. But I can vouch for the fact it certainly did work. But I guess the sensitivity side, that's a recognised side effect.
It's definitely recognised. So you can get special toothpaste to supplement it if you're going through whitening. It's not a long-term issue. It's not going to cause long-term damage and you're not going to get long-term sensitivity. But whilst you're undergoing it with the change in the crystal structures, it is quite common to get a bit of sensitivity.
Brilliant. I'm going to move us on because I had a whole list of whitening products that I have been told about on social media. But it sounds as though in the UK, all of them are fairly useless. But I wanted to talk about something that I imagine is not going to be useless, and that's flossing. And so I guess what I wanted to ask you was, how important is it? Can you get away without it? What's the best way to floss? And how often should we be doing it?
So I always tell people, especially the back teeth, they are essentially square-like, and imagine all the amounts of times you've had food stuck in between your teeth. So when you're brushing, you're only brushing the front and the back and you're not getting the in-between. So that's where flossing or interdental brushes comes in. I personally think you should be doing it every single day. You don't need to do it in the morning because really it's just to remove the food that gets stuck. So I'd say in the evenings, definitely. And I'd say probably from the age of about 14, 15 when you're able to do it effectively and not just be poking around. And my personal advice that I give my patients is do it before you brush your teeth, because the reality is when you brush your teeth, it's quite easy to do your 2 minutes, if that, and then be like, right, I'm going to bed, or I've got to move on and can't be bothered to do the flossing. Whereas actually, if you do it before, you're not going to go to bed without actually brushing your teeth. And my other top tips for it is keep it visible and bulk buy from Amazon or wherever you get it from, because that's the other thing that happens is that they come in small packs and you run out. And it's not like a toothbrush that you can keep using even if it is done. That's what tends to be the big drop off, is that people go to their dentist appointment, they buy a pack, then they run out and then they forget until the week before their next dentist appointment and then get back on it. But I would say that the studies show that gold standard is that interdental brush. but it takes longer than standard flossing. I personally don't love the little kind of floss picks. I don't know if you've seen them. They kind of look a little harp-like. I don't love them because people end up kind of sawing at their gums. So you need to be gentle around your gums, but you want to be thorough and making sure you're getting in all the gaps, but not going aggressively. You can use the water pick, which is like a pressure washer, basically. It is on the kind of the hierarchy, the worst, but to be honest, my personal opinion is if you're someone who doesn't do anything, just do something. And if that's what you get along with and you love a gadget, go for that. Anything is better than nothing. So I don't try to kind of dictate to my patients what they need to do, just something that they're going to be consistent at.
Yeah, it's a really good point. I was going to say, is it best to have it waxed or unwaxed or tape versus string? But I guess it's what you're saying is it's most important just doing something on a regular basis and getting into a habit, which is certainly something I need to do more of. I'm going to move on. So the next thing we wanted to talk about is veneers. Now, I have cheated in life with teeth, and I had a hockey injury and then I fell off my bike, and I've got fake front teeth and some veneers as well. And Mike's put in here veneers, any risks? I'm not even sure if you knew I had veneers, Mike, but. And we're aware that lots of people are actually paying now to just have much nicer appearing teeth or veneers put on their teeth. Is there any risk in doing this? Are there any problems with this approach for a cosmetic result?
So in your case, and historically, veneers and crowns were done because of loss of tissue, tooth tissue. So that's where they were born from. And nowadays, as you say, that people are doing it electively, choosing to shave down their teeth. What we do know is, especially with the crown, so difference between a veneer and a crown: veneer is the front-facing surface, so it sticks on like a poster. A crown is like a traditional cap that goes over the top. With a crown especially, we know that if you take a drill to it and do what we call a crown preparation on a healthy tooth, there's a 10% chance that tooth is going to die off and subsequently require root canals. And we also know root canals are never 100%, so really worst case scenario, a cosmetic decision could end up with a tooth extraction. I mean, that is a bit of a spiral, but it does happen. And similarly with veneers, there is a risk the tooth can die off. A lot of times they're not forever, so you're most likely going to need to replace them every 7 to 10 years, if not sooner. If that's the case, every time you redo it, you're going to have to prepare a little bit more, and it's a step along the pathway of essentially needing bigger treatments that could lead to worse outcomes. So we don't love it. I mean, technology is getting better, and ceramic work is getting better, and you're getting materials that are stronger even whilst being thinner. So from that point of view, it means that we don't have to prepare teeth as much. But I definitely think it's something that shouldn't be taken lightly, and really I think there's a lack of understanding with a lot of patients of the upkeep that's required and the potential risks involved.
Anecdotally, Annie, are you seeing more people asking about cosmetic dentistry? Is that your experience in terms of your patients?
Yes, definitely. I think people are more informed. And I don't know, once again, if this is something to do with historically dentistry was very much rooted in healthcare, and ultimately that still should be the core. But now, whether it's influence from America or whether it's the fact that more people are going down the private route, there's definitely more of a cosmetic focus. So we're seeing a lot of people coming in asking for veneers, or currently what's really popular is composite bonding, which is essentially using filling material to create a handmade version of a veneer. So they're nowhere near as strong as ceramic veneers, but they are a less invasive version of it. So we're definitely seeing a lot more of that.
I've noticed that the UK, I mean, we always got pretty slated by the Americans by just having bad teeth, didn't we? This was, I don't know, going back like 30 years ago. I feel like the Americans always just had glowing white teeth, but we've definitely caught up to a certain extent on that kind of gap in cultural norms. I wonder why that is. Maybe we're just becoming more self-conscious in the UK. I don't know. I want to ask you, now I've been really dying to ask you about this, but there's quite a big argument going on at the moment about the best type of toothbrush. And there's a particular one that looks very sleek, kind of clips to your mirror and is all over. Have you got one of those? It's all over social media about how it just looks amazing, and it never runs out of battery and stuff. Now I've got the old-fashioned. I say old-fashioned. It's an Oral-B, that spinning head one that seems to do the job. And I'm a bit of a Luddite, and I guess I'm a bit resistant to jumping into one of these new technologies or new ideas just because it's really sexily marketed on Instagram or whatever. But what is the best toothbrush, and what's the gold standard? do I need to go and buy a different toothbrush?
It's amazing what marketing can do. I know exactly what you're talking about, and it is marketing, and that's it. The gold standard is a round-headed, what we call oscillating rotating toothbrush, so a round one that spins like that. So the studies show that actually if you use a manual toothbrush effectively, so correct technique, which is small circular movements angled ever so slightly into the gum, for 2 minutes, twice a day, it's exactly as effective as an electric toothbrush. However, what we find is that when you're brushing your teeth, realistically, are you concentrating for that full 2 minutes? Are you paying attention? Are you going over every tooth? And are you maintaining the perfect technique for the full 2 minutes? No, most people are not. And that's where the electric toothbrush comes into its own. Now, the reason why the circular one, the oscillating, rotating one is better is because all you have to do is place it on the tooth and it does the job for you. When you have ones that are traditionally toothbrush shaped, you still have to use the technique for it to work, even if it's vibrating a little bit. So it's just nowhere near as good because it's still completely reliant on the user.
Yeah, but does it stick with a magnet to your mirror? That's what I want to know.
It's not as pretty. And I will say I do have that, mostly because I was gifted it. And it's a brilliant travel toothbrush. But I think if you're going for the most effective, then I would definitely say a traditional round-headed one.
I realise we're jumping from different topic to different topic, but I wanted to move a little bit away from the gadgets and the brushing to a little bit more about a kind of lifestyle and really with regards to diet drinks. So obviously I think we all know sugar is bad for teeth, and you know we're always told from a young age that sugary drinks and fizzy drinks are going to mess up your teeth. But am I right in thinking there's quite a misconception in terms of diet drinks being better for your teeth, or at least being less damaging?
So diet drinks, they are better in the fact that they don't have sugars than normal ones, but they're still carbonated, so they're still acidic. And essentially how tooth decay happens is demineralization of the tooth. So acids into the tooth basically cause it to weaken and the whole forms. The reason we talk about sugars is because sugars feed the bacteria in the mouth, which then secretes acids. But equally, if you have direct acids in, you'll still get damage to the teeth. So any carbonated drinks, you're always going to have some sort of tooth damage. So my top tip is just use a straw. You can still have it, but use a straw and it bypasses the teeth, or at least isn't causing as much damage. If you're looking at kind of sugary drinks, they are really bad. And actually, the biggest issue I'm seeing at the moment is the increase in run clubs. Everyone's suddenly taken up running, which is great. But actually, the amount of sports drinks and glucose gels that people are deciding they need for a 5K run, it's just completely damaging teeth. So it's definitely an education piece, even though it's great that people are becoming healthier and becoming more aware. I think people are kind of taking it too seriously and deciding they need to fuel up, even when realistically they don't. And that is subsequently causing damage to the teeth.
That's interesting. God, I've eaten loads of those crappy gels. I've read somewhere before that it's to do with like the frequency of kind of sugar hits throughout the day as well. Kind of having like, you know, if you have a chocolate bar, if you ate like one piece every hour or something rather than just eating the whole thing in one. Is there some science in that? Is it the frequency of sugar hits throughout the day?
Yeah, it's exactly that. So every time your tooth gets a sugary attack, or essentially an acid attack, it's demineralized, and then it takes roughly half an hour for the kind of self-defenses of the tooth, which actually sits in the saliva, to remineralize the teeth. So you've got this half an hour window to kind of get back to ground zero. But if you're constantly attacking it, it's just constantly in a state of weakened enamel. So what we always say, if you're going to have the chocolate bar, eat it whole in one, because then it's just one sugary attack and it can deal with it. But if you're just constantly snacking, especially if you're snacking kind of every 25 minutes, that's the worst thing, because it just never gets to that healing process, and then it's just constantly under attack. So that's where, once again, those kind of energy gels are just horrendous for teeth. Sometimes definitely required. We all know sports performance, you do need it, but I think sometimes it's a bit of overkill at times.
Now, we're going to move on to gum disease next, and I think there's a really interesting link here, which is slightly different to, I guess, the cosmetic approach to dentistry, which is obviously a huge industry. But the link I'm going to ask you about next is this link that I guess a lot of people don't know about, and I would love some clarity and hear your perspective on this, but about the link between dental hygiene or gum disease and developing dementia, developing cognitive decline. what is the science behind that, and is there any merit to it?
So I think once again, it's this whole idea that the mouth has been removed from the body. And actually what we do know is that everything within the body is completely interlinked. So gum disease, simply put, is inflammation of the gums. It's inflammation of the soft tissues there. A lot of people, they'll be like, oh, my gums are bleeding, and they just ignore it. I think if there was any other part of your body that when you touched it, it was bleeding, you'd probably get that checked out. That's not normal. Whereas people just ignore the fact that their gums are bleeding. And with that, the gums harbour all this bacteria. And when there's inflammation, we know that you can lead to chronic inflammation. And ultimately, that is the link to all the various things. So we know gum disease is essentially linked to diabetes. It's linked to, as you said, Alzheimer's. It's linked to heart problems. It's so many things that it's all linked to. And it's all comes down to that idea of this chronic inflammation. And as you said, with any other part of the body, if you had an area of chronic inflammation, you'd be doing all you can to work out what's causing it and to suppress it and to fix it. Whereas I think the mouth just gets completely ignored.
You mentioned about bleeding of the gums. Is there anything else that people should be looking out for in terms of signs that the gums aren't healthy?
So number one thing is bleeding. So that's the kind of main giveaway. That's what I guess the patient can kind of be self-aware of. When you go into the dental chair, the reason we are poking around isn't to make you bleed, but it's actually to measure the pocketing. So it is to measure how kind of swollen the gums are, and beyond a certain level, then it subsequently leads to bone loss. So that's the other thing, is that some people are allowing their gums to be so inflamed that it's actually causing the bone underneath it to shrink down, and that's what we call traditional gum disease. So things like that. You may have wobbly teeth. So if you have wobbly teeth and you haven't really had an injury, that's a sign of gum disease. What we do know, there's a really interesting study that's been done to do with insurance claims actually, that people who've had a tooth extracted are 70% more likely to claim for medical problems, for medical surgeries.
Wow.
So it's all interlinked. Whether if you've got good oral health, that will link to whether you've got good overall health. Yeah, it's all, as I said, it's just so fascinating that the way we've been taught is that dentistry is just completely siloed from the rest of the body.
It's amazing the number of times that patients come in and ask about dental problems to us, and I feel like an absolute lemon saying, I'm really sorry, but I don't know anything about the teeth. It's all very well us saying go and see a dentist, but as you say, it can be suggestive of a lot of other underlying health issues. And yeah, it's potentially something that, albeit we don't have the expertise to give proper advice, but it maybe is a consideration just when we're thinking about the patient as a whole.
Absolutely. And I think that we're in a really fortunate position that we, on the whole, tend to see our patients regularly. So when I do a checkup, it's not just a case of poking the gums and looking at the teeth. Like when we look at erosion, we're looking at actually, do we have signs of acid reflux? Do they need to go have a chat about whether they've got any kind of reflux issues? Does it look like they may need to have a chat about eating disorders? Because actually we can tell a mile off if they're basically vomiting or anything like that. We do the oral cancer screenings. I said we can, if they're getting recurrent ulcers, we can looking at GI problems or whether they've got deficiencies. So I would say on a weekly basis, I'm referring to the GP because I'm like, you need to get blood tests done or there's something else going on here. And we have that fortunate position that we are having that regular contact, which I think GPs don't, because it tends to be more reactive with GPs. But equally, kind of, I think it needs to go both ways. I think there needs to be better training on both sides. And we graduate as dental surgery and we do the surgery bit, but I still have a strong belief that I think medics need to have knowledge in terms of being able to at least diagnose and be like, okay, do you know what, this is what you've got, but send them to the dentist to actually have it treated.
To the GP, the hit rate of patients that I've received a letter from the dentist saying, please could you consider doing these blood tests, the hit rate is pretty much 100%. There's the letters that I've received that suggested specific nutrient deficiency have been spot on. So, a link. Now, can I go to it? Is this a safe space we can go to? So, fluoride, I'm aware, is in all toothpastes. Although, actually, I'm not sure if it is in my. I've got a 1-year-old. I'm not sure if it's in his toothpaste. I can't remember seeing it in the kids or the really small kids' tooth. I'm aware this is quite a controversial because there's a section of society that thinks that fluoride in water is not good for us, and I guess I'm aware that fluoride can be bad for you in certain higher doses. Do you mind just telling our listeners, I guess, what fluoride is used for, why it's important, and why it is still in our toothpaste? Maybe a little bit about why it's in the water.
Yeah, absolutely. So fluoride essentially is the most effective kind of substance that we know that can fight tooth decay. It basically, the teeth are made of hydroxyapatite. The fluoride comes in, it replaces any demineralized tooth enamel, and it forms fluorapatite, which is basically a nice hard structure as well. So that it fights against the tooth decay. That's why it's important. It's the best thing that we have in terms of what we've discovered. There's something else called hydroxyapatite toothpaste, so it's a lot more expensive to produce, which is why it's not as common. If you get some really high-end toothpaste, you'll find it in there. And it is good, but fluoride is just way more accessible. So from a toothpaste point of view, when people come to me and say, what toothpaste do you recommend? I honestly say, as long as it's got fluoride in, the magic number is 1450, so 1,450 parts per million of fluoride. As long as toothpaste has got that, and I'm talking for kind of adults, doesn't matter, just pick whichever brand you prefer. That's fine. Having it in water, there's some really good studies that show that regions that have naturally high fluoridated water, the incidence, regardless of socioeconomic background, the incidence of tooth decay is significantly lower. So we know it's really positive. And the thing I tell people is like anything, everything in moderation is fine. If you're going to have too much of anything, it's going to cause issues. I'm not encouraging people to just squeeze a whole tube of toothpaste into their mouth. Yes, it'll probably give you stomach problems, but it's still such a small amount in the scheme of things, and having to have fillings and all of that is surely far more toxic to the body, having to have all those treatments, than just having a little bit of fluoride in your toothpaste.
Just following on from Matt's point about fluoride in the water, so I know that has caused some controversy in the States recently. There have been various high-profile figures who have been saying that it needs to be removed from the water. Why are people worried about that?
It's just not really understanding the benefits of it, and a bit of fear-mongering over too much of it. No one's going to be putting something that's going to cause lethal amounts or toxic amounts. It's such a small amount in the scheme of things. So yeah, it's a difficult one, and I do get to an extent you're kind of removing people's rights if you are putting it in something mainstream. But I think if you look at it from a public health point of view, it has huge benefits, and especially in the UK, when once again we come back to that NHS system, every little helps, and actually, if we can just reduce that decay rate, it will make such a difference in terms of the strain on the NHS and the healthcare systems.
Okay, Annie, so just before we let you go, just to put you on the spot, one final to the T, you if you were able to just give 2 or 3 salient points to improve everyone's oral health, what are the top 2? What are the top 2 or 3 things that you would want?
Number 1 would be diet. I think we think a lot about diet in terms of the rest of our body, but just being really aware of the sugars, the hidden sugars, even the good sugars, like in kind of fruit juices, and as I said, energy drinks and all of that, just being super aware of what they're putting into their body. Number 2 would be flossing or interdental brushes. Don't neglect the in-between the teeth. I think that is the most common thing that gets forgotten about, and the amount of times we see holes that are occurring in between the teeth just because they've been completely neglected. And number 3 is, where possible, prioritise going to see a dentist and trying to get into some sort of routine of seeing them. If you're regular, you kind of avoid those treatments that tend to put dentists in a negative light, essentially. If we can get to the point where we're not even having to even consider extractions or anything like that, and just maintenance, your whole outlook on dentistry will be much more positive. I think the thing is with dental health, except for trauma and the odd congenital thing, everything is preventable. With either good oral hygiene or good diet, everything is preventable. So there's no reason you should ever need treatment, but that's on you to take control over your oral health, and also making sure you're going to that dentist for those regular checkups.
Annie, thank you so much for your time. You've been a real star, and it's been really interesting to hear about a topic that, as I said, we're clueless about, really. So I think some really important nuggets to take away. So thank you so much for coming on the podcast.
Thank you so much for having me. It's been fab.